Hello, this is Anna Dolopo. I'm a licensed acupuncturist, and today is my 85th video, and we're just going to do some random cases. The most important case that I really wanted to make a video about today was about this, 80, I believe he's 80. He's at least 80, and this guy is just one of the coolest guys I've ever met. He's a professor at UC Irvine, and this is his second or third. He was an engineer for at least 25 years, and then he went to consulting, and now for the last 25 years he's been a professor at UC Irvine, and he's active. He teaches aggressively. He's very busy, and he teaches some other classes for free at UC Irvine besides the classes that he teaches for a paycheck, because he's still a go-getter, because he's now wanting to teach this completely different topic, and his desire to teach this completely different topic without pay is so that the university will be convinced that he really wants to teach this topic B, and by teaching it for free, he's being very, honest with UC Irvine that he really wants to teach this, so he hopes that they'll give him this second topic for free. So his students really, really love him. They've been loving him there for at least 25 years. And he came in today for his 6th appointment to treat some pretty severe neck pain. And he said he was driving the family kind of crazy because he'd been grumpy. And I treat his granddaughter. I've treated his daughter for many, many years. And I treated his wife. I fixed his wife last year. They had to go on this huge fun trip to Hawaii, and there was no way, they have a timeshare there, and there was no way that she was going to go with a lot of pain. So this guy, we'll just call him T. T really needs to, so before he came in, and being by trade in his early career, an engineer, typically engineers like to see results, and he saw more than enough results for him to be convinced that he should come in. But having said that, he admitted that he was a little superstitious before he came in today because he didn't want to jinx himself and say that he was getting better. And then, but today he told me that he has been 100% since the last treatment, 100% healed, or at least it feels healed so far in the neck. So let me just tell you how many treatments he's received. 1, 2, 3, 4, 5, 6 treatments. March 21, 23, 26, 31, April 2, and April 8. So you can see he's pretty aggressive. So March 21, 2 days later, 23, 3 days later, 26. Then 5 days later, March 31. So just in that time frame, in 10 days, he came 4 times. Then he came in 2 days later, April 2. Then 6 days later, I was teaching in San Francisco over the weekend, otherwise he would have come in sooner. So when I saw him last Tuesday, and he's busy professing at UC Irvine, so there's just, he's a busy guy. He has a very busy life, and he just, he couldn't come in. So let's see. When he first came in, he had pretty intense pain in his neck for at least 2 to 3 months. So I treated him. And then the third treatment on March 26th, he started to feel improvement. And then the 31st, which was his 4th treatment, he said he wasn't sure if he was getting any more improvement. Then April 2, which was the 5th treatment, he was at 50%. And then 4 days later, today, he said he's been at 100%. So not bad for having had the pain for anywhere between, let's say, up to 3 months, at least 2 months. And he's 80. I have found since 1999, since I've been in practice, that age really doesn't matter. I have patients who have healed from chronic pain. 6 months, a year, more than a few years. And they're in their late 80s, 90s. So I learned a long time ago that age is not a huge issue. We're just at 4 minutes and 55 seconds. And I want to pull up his daughter's testimonial that he wrote at last year or a year ago or 2 years ago. It was, she did a prophylactic, she did this surgery, prepared her for surgery. If you go to elementsinharmony.net and you put down not prevent surgery. I did prevent a hysterectomy. This is, let's see, is it post-surgical care? Because this one would be more like, that's not the one. That was post-surgical care. I'm sorry. I just thought about it and I thought, you know what, this would be a really cool thing to pull in here, considering that it's his daughter. Oh, pre-surgical care. So if you go to elementsinharmony.net and you go under testimonials and you scroll down and you go to pre-surgical care, or go down to hysterectomy, and basically you'll see it says at the top pre-surgical care hysterectomy. And I'll just read this. You'll see that there's a picture, if you scroll down, of a lady who has her hands up and she's walking her dog, her beautiful cute little white dog. And this is a very important message I like to share with people, because when people are about to have surgery, they'll usually say to me, you know what, I'm going to come to you after I have surgery. And I tell them, no, come to see me minimum 5 times, if not at least 10 times before your surgery, because your recovery will be amazing. And some people just don't take me seriously, and then they're in bed for like, I don't know how long, suffering from the recovery. Whereas if you're like this woman really healed fast. So I'm bringing this up again because this is my patient's daughter. Hi, Anna. I wanted to share my experience with my recent surgery with you. Because of an increased risk of both ovarian and uterine cancer, I had a prophylactic removal of ovaries, tubes, cervix, and uterus. I was advised by my surgical team, as well as quite a few women who had the surgery, that I would be in great pain and walking hunched over. You and I talked, and you recommended I get acupuncture treatments prior to the surgery, as it would help avoid pain and was more important than coming after surgery. Just like what I said. She pretty much said it verbatim in her testimonial. We had several sessions prior to my surgery, and I am so happy to report what an amazing recovery. I was discharged from surgery 2 hours after walking completely upright. I never had to take a single pain pill. The nursing staff who checked in with me could not believe that I did not have to take the prescribed tramadol. That's a prescription, not something over the counter. But that I also did not even need to take ibuprofen. So there were 2 medications that she would have been given easily, because that's major surgery. And they were surprised that she didn't have to take tramadol nor the ibuprofen. The day after the surgery, I was able to take the dog for a walk up and down the street, no problem, picture attached. No one believes me that my recovery has been this amazing, but I know you do. Thanks so much for making this an easy and pain-free experience. So she's super excited. WJ is super excited to, or was. And I did see her a couple of times afterwards, and I did not treat her for pain. I treated her just to relax. And so if I were to look at exactly when she came in, I know for a fact she did not come in more than 5 times to come in for that. I'm going to her history. This was back in, last year. No, it must have been 2017, because I remember it was around the summer. So I saw her, I want to say August. So August 5, 9, 12, 12, 16, 19, 23. And I think those were the only treatments that she received, because she came in a few more times after, but that was like post-surgical care, but she really didn't have any pain. So I really wanted to share those. It was really the neck one that I wanted to share because that was just really amazing. Her dad just recovering so quickly. I was really, really surprised because, I mean, even to this day, after 21 years of practice, it astonishes me when someone heals that quickly. That happens 85+% of the time, but even now when I see someone older just recover so quickly, it's a testament to Dr. Tan's balance method. There's a woman that came in today for lower back pain, and today was her 25th treatment, and she's at 70% improvement. She's had this pain for a very long time, and she had seen other acupuncturists and chiropractors and physical therapists before she came to see me, and she had very minimal success. And so it's important for me to underpromise and overdeliver. So I gave her what I recommended. I told her that the beginning phase of chronic issues is the first 20 treatments. Today's her 25th treatment, and she said she has been feeling so good. 70% to some of you might not seem like a huge deal. So I'm bringing this as a contrast to the other person who's had his pain for about 2 to 3 months, and that it seems like it might be gone now that today was the 6th treatment. So after 5 treatments. Some people and this woman is at least half his age, and she'd been suffering from very long, very chronic lower back pain, and she's so happy because when I text my patients in the morning, I'll say, what is your intention for today? And some of her intentions were, I want to be able to do more chores in the house. She's a homemaker. I want to, she wants to travel. She wants to do all kinds of things without having back pain. So let me just tell you what her treatments have been like. January 25, 27, 29, 31. That was just January. So you can see how aggressive she's been. February 2, 4, 6, 8. And then February 11, 14, and February 16, 18, 21, 23, 25, 28. You could see how aggressive this woman is. She is on top of it. She really wants to heal. And each treatment is a little bit at a time, a little bit at a time. March 4, March 8, 11, March 15, 19, 25, 29. And then, so a little less aggressive in March, and then April 2, and then today's April 8. She is determined, and she's so excited to be at 70%. She had never hit that much improvement with any of her other practitioners, and not just acupuncture, but, I mean, she just wasn't getting improvement out before she came in to see me. So I'm so happy that she's getting results, because that's what that's what my practice is all about, is getting tremendous results. So the first one I treated was the one that I explained is an 80-year-old man, and the second one is his daughter, the one that I did a couple of years ago for preparing for prophylactic surgery. That's a huge deal. She took out her uterus, her ovaries, her cervix, her fallopian tubes. I mean, that's like a cesarean, big deal. And then there's this young lady, and then the other one that I shared was that case is a woman in her 40s. She's older than me, and her kids are older than me, and she's so excited to see that she's already improving. This one, we'll call her N, and she came in for her second appointment today, 5 days after her last one. Today's April 8. I saw her April 3. We'll call her N, and N came in last week, and in one treatment, she was already 30% improvement here. And that's a big deal because she had a lot of pain. She had a lot of pain before she came in to come see me last week. So she is so happy that she's greatly improved. Let's see what other There's another woman, we'll call her Jay. She came in, I believe today is her third appointment, and she had this back pain for a while. Everyone was telling her she needed to do it, and so she finally did. March 28th, April 1, and April 8th. I was away in San Francisco teaching and taking some classes, so there's a little bit of a gap. Today, she said overall her lower back pain is 80%. So, these are the kind of results that we get. She came in initially March 28th, and when she came in, she said she had back pain, but mostly the quadriceps were just painful. And after her first treatment, she had no more quadriceps pain. And then she came in today, third treatment, no quadriceps pain, and her lower back is 80%. And I'm also treating her knee. So, boom, 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 we're getting great, great results treating all these people. Those are the cases worth mentioning today. The others are a little off topic in regards to fertility, and so I don't really want to mention those. But if you are interested in coming in for pain or anything you need to graduate from your suffering and whatever pain you're in, feel free to go on my website at elementsinharmony.net or just call me at 949-305-1703. That is my office landline right here. It always gets forwarded to my cell phone. So you can text me at 619-341-4341. I appreciate you watching. And if you have any questions regarding pain, just give me a call. I'm almost certain I will tell you that I can probably, at least give it a really good try to help heal you from pain. But normally I have really good results. If you want to check out my work, you can go to elementsinharmony.net and also at moveyourqy.com. Those are both of my websites, and they're filled with a ton of testimonials, case studies, and some videos. All right, take care. Have a great day.